Good evening, ladies and gentlemen. Welcome to Reference Point. I'm your host, Dave Cokerhook, and with me today is a friend and colleague, Sumant Pendharkar, and I've asked Sumant to come and join us today because we're going to talk about a topic that I think is, well, it's relevant to me anyway, and it has to do with the topic of Medicare. When you look at the demographics, the baby boomer generation, which is a generation from 1946 to 1964 when they were born, those individuals are turning 65, approximately 10,000 individuals per day. And so we're in the midst of this reality that the Medicare system is getting more and more people into it. And yet, if they're anything like me, there's a little bit of a confusion as to what the Medicare system is all about, what these various things mean and whatever. And my friend and colleague Sumant is here to talk to us and help us understand that. Sumant, good evening. Welcome to Reference Point. Happy to have you here.
Thank you, Dave. Good evening to you too.
So Medicare has been around for quite some time, and all through your earnings years, you pay money into a system that goes into Medicare and whatever. But I'm not sure that we all understand exactly what the program is and what it's there for. Can you give us just sort of like a very high level description of what the program is all about?
Sure thing, Dave. I can do that, but I do need to state some facts upfront. I'm a licensed independent agent. I do not work for either Medicare or the federal government. I specialize in Medicare Advantage plans, Medicare Supplement plans, and Medicare prescription drug plans. I do represent several carriers, and I do have access to vision, hearing, and dental plans.
Okay, which is helpful to know because a lot of these things, we see this information on television about different plans and different kinds of things, Medicare Advantage this and Joe Namath talking about that and all this sort of thing. So the fact that you've got those kinds of experience is going to help us in our conversation and understanding about what's going on. So,
Great.
Just start off with a high-level overview of what Medicare is all about.
Sure thing. So Medicare is a federal health insurance program. It is something that we get access to if we have worked for 40 quarters, typically 40 quarters, and paid into the Medicare system. And that, of course, is when we pay our taxes, we are paying into the system, which then entitles us to something known as Part A in Medicare. I will be talking to you more about the different parts of Medicare momentarily, but since you asked on a high level, we're looking at Medicare that is accessible nationwide for US residents, either citizens or US residents who lived in this country for 5 years or more, and also are typically 65 or older. It is available for those under 65, but under special circumstances, especially if they're disabled.
So let me see if I understood part of what you said correctly, because this is something I hadn't understood before. It's like you don't necessarily have to be a U.S. citizen to participate. You have to work here in the United States and have earned income in the United States for a certain period of time in order to be able to qualify for Medicare. Did I understand that right?
You don't have to be a U.S. citizen, but you have to be a legal resident.
A legal resident. Okay,
yes.
Great. Thank you.
And have lived in this country for 5 years or more.
Okay, perfect. So, so that's helpful. All right, so that's the high level. And age 65 is about the time when you can. Is that the age that somebody should start their engagement with Medicare?
Depends. If they are already, let's say they're employed by obviously an employer and they get something known as creditable coverage from their employer, they do not need to start taking advantage of Medicare.
Okay.
They can delay the whole process till the time they actually leave the job or lose their creditable coverage. I am going to share the information about the creditable coverage because it's a very important term. So if somebody works for a company and they don't have what is known as creditable coverage, they could be levied a penalty for starting their Medicare program late.
Oh, what starting the program late?
Yes, as in
What's that all about?
if they've gone past 65 and let's say they're working for XYZ company and the company provides insurance which is not equivalent to what Medicare would provide, and that's we're going to get deeper into this, but Medicare Part A and B, then the employee would be hit with a penalty when they eventually start taking Medicare.
Now, is it possible to start taking Medicare while you still have a coverage from another plan through an employer?
Yes, absolutely, you can start on that. The way to really evaluate that is to have a conversation with the benefits or HR of the company that this person's working at, and they should compare what the company has to offer and what they would get from Medicare. Because we all know that when it comes to making any kind of a payment, they need to know who's responsible for what part.
Right.
And to get that level of information, they should ideally work with the benefits person from the company.
Okay. So if the coverage through the private employer is equal to or better than Medicare, then you don't necessarily have to start Medicare. If the offering through the employer's plan is not equal to what you could get with Medicare, can you have Medicare and the employer's plan?
You can have both.
Great. Oh, that's interesting. See, that's something I never knew. And I don't know how many of our viewers knew this either. So that's really cool information. Thank you.
But again, it's a caveat that this employee should work with their enrollment person, benefits person, and
Right.
find out the responsibilities
Got it.
and
Okay.
how it is going to work together.
Very cool. Thank you. Okay. So I get that at a high level, that's what it is. And you mentioned a couple things. You mentioned A and B. Can you help us understand what is this Medicare A, Medicare B differentiation?
Sure thing. Part A is something that somebody gets entitled to based on the taxes that they've paid. And typically the expectation is to have worked for 40 quarters in their lifetime. And so spouses can get entitlement to Part A based on their other spouse working.
Mm-hmm.
So both
Oh,
don't have to
okay.
have worked.
Oh, okay. That's interesting. I didn't know that.
And for example, let's say somebody has, and I would refer anybody who's looking to see if they've worked enough quarters to go on to set up an account on the Social Security SSA.gov, and they will have that information when they create their account of how many quarters they've worked and if they're entitled to Part A.
Okay.
And I would also recommend, so ideally go to Medicare.gov site, and they can also figure out if they don't have enough quarters in, what their Part A premium will be.
Ah, interesting. Okay.
Assuming you and I both work for 40 quarters, which I know I have, I am entitled to Part A.
So that's what I think I found that image that you were talking about. I think that, let me pull this up. This must be what you're talking about then when you talk about what is Part A, what is Part B. Is that what you meant?
That's correct. Yes.
Okay. So go ahead.
I wanted to just finish up the Part A part that, once they find out that they work for 40 quarters or more, they have no premium for Part A.
Okay.
There is a premium for Part B, and that Part B premium is something that everybody pays. And currently for 2020, the Part B premium is $144.60.
Okay. So Part A, it says here, helps pay for hospital stays and inpatient care. And Part B helps pay for doctor visits and outpatient care. The word helps there kind of implies that it's not 100% coverage. It's not if you go into the hospital, Medicare is going to cover everything. Is that correct?
No, that's correct. It is not going to cover everything. And the slide that you had shown before this one, we'll come back to that, and then that'll tie that in to what Medicare does and what the outside insurance carriers do.
Okay, got it. And when do you want to go to that?
Oh, no, wait. Well, let's stay on this slide for just a minute.
Okay.
So the Part B premium, and we're seeing what Part B does, and which is for doctor visits and outpatient care, And then Part B also covers preventive screening.
Mm,
And there's some other, they can get durable medical equipment, wheelchairs, things that they would need for helping them with their health.
got it.
That is
Okay.
typically covered under Part B.
Okay.
Part A is hospital stays, inpatient care, and hospice.
Got,
That gets
oh,
pretty
okay.
much covered under
Okay.
Part A.
Okay.
For Part B premium, I know I'm saying this now, we can probably cover this later if needed. Part B premium is dependent on the income, adjusted gross income from 2 years back.
Oh, okay.
So,
Let's restate the thing. The Part A, you don't have to pay a premium for the Part A coverage. The
if you
Part
work
B
for 40
coverage,
quarters or
if you've
more,
worked for 40 quarters
yes,
in your lifetime. And then the Part B is different. Part B does require some contribution from the citizen, from into the program to cover certain expenses in it, and the actual dollar amount will be dependent, as you said, on age. So we don't have to go into the details on that, but that's something that people need to understand, right?
the premium, Part B premium, is based on income.
On
And that
income.
is, yes, not on age, it's based on income. And that income, the actual term for that is called IRMAA, IRMAA, income related monthly adjusted amount.
Okay.
And that is, so the 2 years back tax returns will determine what the Part B premium will be.
So the premium might adjust year after year. If your income's
Yes,
going down, the premium might go down.
there's always a base premium, but the premium will go up if the income from 2 years back is more. So
Understood.
let me give you an example. If somebody sells their business while they're on Medicare, and that particular year they have suddenly a 200% increase in their adjusted gross income,
Mm-hmm.
then 2 years out, that bump in pay will affect, which will fall under IRMAA, will affect their
Right, their
Part B
premium.
premium.
Okay, got it. That's useful knowledge. Thank you.
And once that, let's say after that 1 year has passed, now it's the next tax year, the person can go back and appeal for adjustment for their Part B premium,
Okay.
because now it's that year's income, say from 2 years back.
All right. Cool. All right. Well, this is, by the way, folks, I'm going to stop this share for a second so you can see me. So I want you to know that as we're having this conversation here, if you have any questions that should about the Medicare program, Sumant has been gracious enough to say that he'd be happy to answer any questions. So you just send them to info@referencepointtv.com. I'll funnel them over to him. He can respond to your questions if you have any. So, Sumant, let's take a look now. We've got about maybe 15 minutes left in our showtime here. So we mentioned the A and B, and then there's this other stuff that's available, I think, to help cover that difference. You mentioned that Medicare helps cover, but it doesn't cover everything. But there are some other options that people have to mitigate the difference. Yes.
That's correct. So if you wouldn't mind bringing up that other slide that you had, I will be happy to put that into perspective.
This one?
Yes, thank you. So
Okay.
the original Medicare that the government gives, that does not have a cap on maximum out of pocket.
Oh,
So
okay.
the exposure to the patient's portion could be unpredictable.
Okay.
So let's say on a certain procedure, the regular original Medicare covers 80%. 20% comes from out of the pocket of the patient. Because cost in Medicare, in medical services is unknown, they can just go completely out of hand. There is no cap on maximum out of pocket. So private insurance companies stepped in and they offer two different Medicare plans. One is called the Medicare Supplement Insurance, also known as Medigap, and something known as Medicare Advantage Plan.
So this one over here in the red is the Medigap, and this one is the Advantage.
Correct.
Okay. All right.
And so both of them have their, they basically allow people the flexibility to choose based on what works for them.
Oh, okay.
And just something that's worth mentioning at this point in time is in the same household, husband and wife can have completely different plans.
Oh, I didn't know that. That's
So,
good to
and
know.
there's usually no group discount for
Right.
signing up. Well, we won't go into that right now. Let's just talk on the high level part first. And that is you select the plan based on what your needs are.
So what are the major distinctions between the Medigap and the Advantage?
The Medicare supplement plan gives let's say the enrollee or the beneficiary, that's the best term to use would be a beneficiary, the option to go to any doctor that accepts Medicare anywhere in the country.
Oh,
So let us take an example. Let's say somebody lives here in California and also has a house in Florida, and they spend 3 or 4 months of the year in Florida. They can go to a doctor that accepts Medicare when they're in Florida, and same thing when they're here in California.
okay.
If
And
they're
I'm guessing that applies not just to U.S. states, but if you're like in, Guam or Puerto Rico or the U.S. Virgin Islands, it would cover there as well.
they're covered in all the 50 states, I would have to look up where if they are. Um, sorry, I'll need to get back to you on that one.
Okay, that's fine. All right. So if you can travel anywhere in the U.S. If as long as and, uh, any doctor that accepts Medicare, you could go and see if that was appropriate. You're like you said, you're maybe a Californian, but you spend 6 months of the year or part of the year in another location, and okay, so that makes sense and that's reasonable. And what does that mean relative to the Advantage plan?
The Advantage plan is based on where the person resides. So it is typically county specific. So if you're living in Santa Clara County, we'll be looking for plans that are available in our county. I mean, you and I are both in Santa Clara, so I'm just taking that as an
Right,
example. But
right.
if the beneficiary happens to live in Alameda or Los Angeles, they would be selecting plans that are appropriate to them and offered to them in that county itself.
Okay,
And then
so
they are typically restricted to stay within the county in the plan that they've enrolled for or enrolled in.
So if that sort of implies to me that if you don't do a lot of moving around, then you're good. If you are more mobile, you have family around the country and you spend a couple of months here, a couple of months there, that sort of thing. Maybe the Advantage plan it might not be the most advantageous for you, depending upon your health situation, I guess. And is that a reasonable statement?
Yes, that would be reasonable. Yes, for sure.
Okay.
So the supplement plan gives you a lot more flexibility. You can go to, again, the main thing is have a chat with the doctor that you plan to visit, find out if they take advantage. Sorry, I beg your pardon. They take Medicare.
Mm-hmm.
Let them know the kind of plan that you have, and if they say fine, then you're golden. You can just go direct.
Okay. Very cool. So, all right. Well, that helps explain that. And
Dave?
the other thing I was wondering about in these things, because we see these ads all the time, I think there's a lot of push on these Advantage plans. It sounds like you see them on TV promoted a lot. But I think it's helpful that from what you just described for people to understand that you have to look closely to make sure it is appropriate for your lifestyle. Because I guess the two different programs, the Medicare supplement plans and the Advantage plans, are something that you need to consider based on your lifestyle. You probably want one or the other because they help to cover that difference between what Medicare covers and what Medicare doesn't cover in the way of expenses. But you need to figure out what's going to be the most appropriate for your lifestyle. Is that a fair statement?
Yes, that too, but there are some more considerations to take into account as well. And one of the major ones would be if you have a preference for a certain doctor, you may want to go first check, and that's something that I could work with a beneficiary and find out which plan would be appropriate for them based on where the doctor is placed.
Oh,
Our industry is highly regulated, so I will not give you a detailed example at this point of time. But the way I would put that is if their primary care physician of their choice is in a certain medical group,
mm-hmm.
then it would be in their advantage, there is in the beneficiary's advantage to select an appropriate plan.
Got it.
I should not be
Regardless of
using the word
whether or not,
advantage here.
regardless of whether or not the doctor's office is in the county in which you reside.
That's correct. And
Ah,
your primary care physician is in the same area, or well,
okay.
same county that you're in.
Okay. Well, that's a very important piece of information. We've got about 7 minutes left in the show. I'm going to ask you another question here, Sumant. It's somewhat kind of related, but maybe slightly askew here because we've been talking about Medicare, but there's also things that I have seen here in California, and I think with other states where my wife's aunt was in Nevada, and they were applying for Medicaid, which is a different kind of a thing. What is the distinction between these two things, and how do they, if at all, fit together?
Medicaid is a federal and state program that helps beneficiaries typically on low income or limited resources.
Hmm.
So regular Medicare and of course Medicaid works with Medicare, but offsets the expenses. So there's no cost in many different ways for somebody who's entitled or who qualifies for Medicaid.
So you could have both, is what you're saying, depending
Yes,
upon your financial situation.
and resources, and sometimes based on health, they can
Right,
qualify for something known as Medicaid. And California's version of that is Medi-Cal.
right. Okay, okay.
And the way to
That's
find that
interesting.
out is to make a phone call. They can call their state assistance program and get that information to find out if they qualify for it.
Okay, cool. All right. So, um, what should a someone who has either reached that point where it's well, I'm going to roll back a little bit because something you said earlier was real interesting to me, and that was um, if you don't register, is it register for Medicare or at a certain time, or when you reach a certain age, there's a
Need to,
there's a
that's
penalty
right.
for it?
You need
Yeah.
to get enrolled with Medicare, and you need to start your Part A and Part B. So the enrollment period is very critical.
Okay.
Typically, somebody who's approaching age 65 should start planning which way they want to go to, whether they will take original Medicare, they want the Medicare supplement, or Medicare Advantage plan.
Okay.
And these are called various enrollment periods.
Okay.
So the initial enrollment period is when the person qualifies for Medicare, which is usually one time in their life when they're turning 65. That's the time when they have 3 months before the birthday month, the month of the birthday, and 3 months after.
So
So within
within that window,
yes,
you should be applying. Otherwise, there's some penalty for doing it late.
correct.
Okay.
And as long as you have creditable coverage, you don't have to start your Part B because the premium that you're really paying is on the Part B premium.
Okay. So let me see if I got that. You need to register, but you don't necessarily need to start taking advantage of it or to implement it. Is that right?
Basically, you don't have to trigger or start your Part B
Trigger. There you go. That's the word. Trigger
till the
starting
time
Part B.
you are ready, provided you have creditable coverage from your employer.
All
So
right.
let's say somebody's retired at the age of 62 and they have private insurance till the time they reach 65.
Right.
That's when they're in regular circumstances, they would be starting enrolling for Medicare at the age of 65.
Right.
And that is the initial enrollment period that they have for 3 months prior, the month of the birthday, and 3 months after.
There's a lot of folks like myself who are still in the workforce who are past age 65 and who may have a really good plan through their employer. So what I'm hearing you say is that you need to register with and get your Part A thing established. And you don't necessarily have to begin taking advantage of Part B if your existing coverage with your employer is sufficient and it works for you from a financial perspective. And but you have to have registered if you're at that 65 age. Right? Is that right?
Yes, Dave, I'm going to be a little precise in what you just described. Instead of saying sufficient coverage, change that to creditable coverage.
Creditable coverage. Okay.
That is absolutely critical, that the medical plan that they have from their employer provides them what Part A and Part B would give them, and also that their drug coverage also is creditable.
Okay.
If
Great.
not, they will be paying a penalty for Part D coverage as well. And we haven't spoken about Part D yet, but if you went back to your original, one of the slides which showed the supplement plan,
Yeah.
at the bottom it shows Part D. Part D stands for the drug plan.
Oh, right. Yeah.
And somebody who takes a supplement plan would have to take a separate standalone drug plan.
Okay.
So they can choose. They can choose a supplement plan from one carrier, and they can take the Part D prescription drug plan from another carrier.
From somebody else. Okay.
From somebody else.
Sumant, we have just slightly over a minute left in showtime here. So what are your closing words of guidance that you would like to suggest to people and who may be at that point in their life where they need to be thinking about this?
Two things. One is watch out for the dates. Find out in advance when you need to be doing what for the enrollment. That is absolutely critical, because otherwise for your lifetime you'll be paying penalties on Part B and Part D for late enrollment.
Mm-hmm.
And the second thing, I would advise people who are already on any of these plans to reevaluate every year. Plans change, the coverage changes, the drug plan tiers change. We haven't had any time to talk about that yet, but I would say that they absolutely, I would recommend that they have their plans reevaluated every year.
And I think if I'm not mistaken, there's like a regular annual time when that happens, right? There are certain other things that give you the opportunity to assess a plan or make a change, but there are basic window. There's a general window when that usually occurs, right?
That's correct. And one of the windows that's coming up now is the annual enrollment period, which starts on October 15th and goes through December 7th. I can talk about plans starting from October 1st.
Sounds good. Well, Sumant, thank you for joining me for this conversation today. I very much appreciate it. And I hope, ladies and gentlemen, that you also have learned something here about this whole topic, because I know I have. And I know it's relevant to me and my family as well. So, Sumant, thank you again for joining us here at Reference Point. And ladies and gentlemen, we'll see you next time.
Thank you, Dave.